So obviously no one likes to feel left out, and being excluded by friends or family, especially a spouse, is painful. It can feel childish. So today, facts to know about the silent treatment to help couples stop the hurt and start to heal relationships. Psychologist and Studio 5 contributor Dr. Liz Hale joins me. It's so funny because as we talk about the silent treatment, verbally, as we say it even, it sounds so silly and so childish, yet you know it happens in relationships all the time.
Well, it does. As a matter of fact, earlier this week, Ben asked me, my husband, he said, so what's your segment on KSL this week? And I said, and I paused, and I said, the silent treatment. And he goes, oh, you're good at that, honey. That's good. And I don't think he stopped himself. He goes, actually, I think I probably do that more to you than you do to me, which is true. Men probably stonewall or give the silent treatment a little bit more. We are the queens of criticism, the women, but I have done my fair share of it. And it really reminds me, looking at some of these studies, that we really have this power as human beings to either hurt or to heal. You know, and it's really mindful of me. It's like, how many times have I done that in my life? I know what it feels like to be on the other end of a silent treatment, right?
Yes, yes.
Oh, it's so painful. It just hurts.
Frustrating.
I just read an article before I came on that talked about invisible bullying. Ostracism, exclusion, invisible bullying, and that's true. And there aren't any bruises, and we think we're not really doing great harm. I don't even think we intend to do harm. Sometimes we're just thinking, I'll take the high road, right?
Well, I was going to ask you, is the silent treatment always bad? Because I know a lot of times it helps me to pull back and cool off before I address a heated or sensitive issue in the moment. Is it always a bad thing?
It definitely has its place. It really does. And sometimes I think it's kind of one of our bullet points. It's taking a time out. You know, just say, even if you're just saying, you know what, I am getting flooded here or overheated. Let's take 20 minutes and let's break, or let's change the subject. Let's talk about something different, or let's agree to disagree.
So what then, define for us, what would be the difference between a healthy timeout and a hurtful silent treatment?
Right,
What's the difference there?
right. So I think having a conversation about it, like, you know what, I am getting flooded, so let's take 20 minutes and then go do something totally different. Don't rehearse, in other words, what you're going to say when you come back to the table. Instead, go take a bath, go take a walk, go to the mall or the store, go trim the yard, do something different, and then come back and at least allow yourself to be physiologically soothed, because our blood pressure is up and our pulse, our cortisol treatments, and cortisol numbers rather, and we can't really even listen, let alone talk.
I like that. So talk before you fall silent. At least establish what you're doing and why. You also say, and you touched on this, there are some things we can do to help thaw our cold shoulder.
Yeah, we have to, right? And again, a part of that is just realizing the power that we have in our relationships, and what are we doing to other people, and how are we really coming across? You know, think about the shoulder, Brooke. I mean, it comforts a baby, right? You put your baby there, or you comfort a spouse there. I think we all have to be very aware of the behaviors that we elicit and how they come across. So just notice, like, I want this to be a safe place.
How important is it to be aware of those simple things, even the small things that your spouse is putting out there, to let them know that, hey, I love you, I'm not ignoring you? Those little details you say really can matter.
Yeah, they do. They matter greatly. Just even like if you are flooded, in other words, and you want someone to know that.
Yes,
you mean? Yeah, and just say, you know what, let's take a time out. Have a sign even. A lot of clients will do this time out. Let's just take a break so that we can both come back and reorganize ourselves. We all so much want to be known, and to be loved really means being noticed and being known and being seen. And when a partner walks into a room, recognize them, you know, or any family member. How you look at your face. How are you responding when you look at someone? I've really tried that lately. Ben talks probably far more than I do. He's more of a talker. And I've really tried to look at him with gentle, softened facial expression, you know, and really seem interested, because I think sometimes I get a little maybe annoyed, or I feel I'm a little too busy. I don't like that about myself. So really see that you're there to tell your partner, I love you, even in the nonverbal.
I love defining love in this context by attention. And I think I appreciate your openness and candidness. I think everyone's in that stage, especially with screens and technology and social media. It's so easy to think we're listening with one ear and our eyes are elsewhere. So that attentiveness, I like that reminder to be more attentive to those we love the very most.
Yeah,
very good. A healthy way to cope, you say, is to practice mindfulness. We hear a lot about this these days. Mindfulness is kind of having a buzz moment, if you will.
Yeah, so true. Well, you know, it's interesting about the brain and this kind of pain of being excluded or the silent treatment. It registers like physical pain in the brain.
Really?
So think about what people do when they're hurting, right? They take a drug or a drink. I'm not necessarily recommending that, but regarding mindfulness or prayer or meditation or taking that walk, doing something that soothes you, or reminding yourself of the people that do love you. You know, grab your pet, for instance, or your child, and think about the things that are going well. That this is a moment in time that you're feeling excluded by a family member or a colleague at work. It's not going to be forever, and it's painful, and sometimes I've done it. Sometimes that helps me be more patient with other people. It's like, oh, I know I've done this. I know I have. And it helps the hurt a little bit.
Yeah, soothes the ache.
You know, we're all just human beings.
We've applied this advice to the marriage relationship, which I think is probably the most common situation when it comes to the silent treatment. But I know a lot of girlfriends who have really been hurt and frustrated when they're stonewalled by a teenager or a child. Do these same tips apply, Liz, for breaking through someone of a different age or different generational mindsets?
Yeah, absolutely. And there's nothing more painful when a child does that to you. I mean, I can only imagine how that hurts. And sometimes a child doesn't know that a parent hurts. They didn't know that. They're so kind of self-absorbed, right? Because they're just kids. They can't help themselves, really. Sometimes they realize, I didn't realize that you were hurt until you told me, Mom. It's like when a mother can say or a father can say, you know, I'm just crushed. I'm crushed that you walked into a room and we didn't even speak. I don't want to have that kind of relationship with you. I want us to get back on track. You know, what's that going to take? Can we have a do-over? Can I start again? Will you please forgive me? Can we please talk?
I like that.
Shutting me out just hurts. It hurts so badly. Even though there's no bruises, I feel bruised inside.
Yeah, hurts all around. I really appreciate this. This conversation, I think, promotes that self-awareness, that self-discipline that we're striving for in our relationships that you're helping us cultivate. So thank you so much, Liz.
Thank you, too.
We love and appreciate you.